Merci. Further debate, the Honourable Member for Etobicoke North.
Thank you, Speaker. First of all, it's an honour, a privilege, and of course responsibility here in this chamber to rise and speak in support of my honourable colleague, Dr. Helena Jasic from Oak Ridges Markham, on the Congenital Heart Disease Awareness Day and Week proclamation that she's brought forward, Bill 178. Of course, Speaker, as a physician myself, as a graduate of the University of Toronto, class of 1988, I'm also honoured and privileged to welcome many of the members from institutions that I happen to train at, Toronto General Hospital as well as the Hospital for Sick Children. I can remember, for example, Speaker, I believe in probably first, maybe second year med school cardiology rotations, when we had the privilege of actually visiting individuals who had congenital heart disease and had then come for surgery and aftercare in the operation, after surgery and operations and the various other rehabilitative measures. We had the opportunity to, as we say, listen to the chest, or clinics of auscultation, which is a fancy word for the doctors taking out their stethoscopes and listening to the various patients and experiencing and examining them. And I have to say that it was, first of all, not only an extraordinary teaching opportunity, learning opportunity, but it was probably, from our perspective as relatively young and green medical students, frightening. Because, of course, we had been used to hearing the chest sounds, the heart sounds, in a particular way, often not with excessive amounts of pathology, the heartbeat, maybe an occasional extra sound, which we physicians might call things like heart murmurs. But when we listen to the individuals with congenital heart disease, the best way to describe it was as if machinery, or probably Jurassic Park, or motorcycles gone awry. And you can imagine listening to individuals who had these kinds of heart sounds when we all kind of did a sort of double take, wondering how these individuals were actually functioning and how they were actually going about their day-to-day activities and calling upon the reserve capacity of the heart. So when I see this particular bill, Bill 178, an act to proclaim February 14th as a Congenital Heart Disease Awareness Day, I think it's a very commendable act, and I would commend not only the member for Oak Ridges Markham for fusing or conflating her professional expertise with also her parliamentary abilities here in bringing this both health and welfare bill forward. But I'd also, for a moment, like to commend our colleagues from the Conservative Party, the MPP for Whitby-Oshawa, Ms. Christine Elliott, as well as Madame France Gelina, le député de l'Assemblée provinciale de Nickelbelt, for not only their support of this particular bill, but also for their very lucid and comprehensible explanations of medical terminology. I enjoyed relearning some of the information that you presented. As has been mentioned, this is the most common cause of all birth defects. Approximately 1 in 70 Canadian newborns have it. Something on the order of about almost 40,000 adults in the province of Ontario have congenital heart disease. And just to make it clear, Speaker, first of all, heart disease as a domain is, as you can appreciate, a collection of illnesses. We would tend to think perhaps of heart disease as perhaps a disease, a group of disorders more towards the middle age of people, say 35, 40, 45 and above. Things to do, for example, with smoking and cholesterol and high and poor exercise and high blood pressure and sugar diabetes and all the rest of it. This is the opposite. This is heart disease that one is actually born with, and that's of course de la naissance, or right from birth. And that's of course what makes it especially acute, especially poignant from an emotional point of view, because you're dealing not only with the very young children, but also the emotional turmoil that, of course, the parents are going through. And so that's why it's very important, I think, for all of us in our various domains to support this type of legislation. Monsieur le Président, j'ai le plaisir aujourd'hui de me mettre debout pour soutenir ma collègue, l'honorable Dr. Helena Jasic, députée provinciale de la circonscription d'Oak Ridges Markham. La maladie cardiaque congénitale est une plus grande cause de la malformation à la naissance. Elle affecte un enfant sur 70 nouveau-nés. 12 Canadiens naissent chaque jour avec cette maladie cardiaque. Il y a beaucoup de sortes de ces malformations. Des connexions anormales dans le cœur ou entre les vaisseaux sanguins, des problèmes avec les valves ventriculaires, problèmes du développement ou de mauvais emplacements. Comme médecins, nous évaluons à presque 200 000 Canadiens, tout âge confondu. Au Canada, il y a plus de 100 adultes qui ont subi une intervention chirurgicale à l'enfance pour corriger cette malformation. Speaker, Monsieur le Président, malheureusement, plus ou moins la moitié de ces gens font face à beaucoup d'interventions chirurgicales ou la mort précoce ou subie. Aussi, Monsieur le Président, je vais exprimer et partager avec vous, avec tous les Ontariens et Ontariennes, les signes suivants de ces maladies. Un murmure cardiaque, décoloration un peu bleuâtre de la peau, les médecins disent par exemple cyanose, respiration rapide, malnutrition ou malabsorption, disproportion entre l'âge et le poids, fatigue pendant l'exercice physique. And Speaker, that's why it's so important to support this particular bill, and I will yield the floor to my honourable colleague from Halliburton, Kawartha Lakes, Brock, Mr. Rick Johnson. Thank you, Speaker.